Dr. Yusuf. I am from Idlib City Hospital. I'm going to be talking about the digital health and digital addiction. Of course, I'm going to be going quite fast because my colleagues have already mentioned many of the topics that I was going to talk about. So I'm going to talk about today the health implementations. There's been a presentation at 3 o'clock yesterday. A foreign team has mentioned about this topic yesterday. After 2020, there's an inorganics application that received an FDA approval for attention deficit, and also there are some other applications are also being evaluated. So I'm going to be skipping some slides. So what is digital health? What is addiction? What's the differences? So we can talk about the physical and spiritual well-being to be increased in that sense. That's the objective here. So for the criterion, when we look at the purpose, we can talk about the monitoring the health, accessing treatment, and supporting mental well-being. And for the digital addiction side, we can talk about pleasure seeking, escaping from reality, impulsive use. When considering usage pattern, for the digital health, it is planned, controlled, and functional. For the digital addiction, it is more dysregulated. For the digital health applications after COVID-19, there's been an increase, significant increase. If we start with telepsychiatry, and then there are mobile health, and there are some wearable technologies, and also YouTube-based psycho training videos that are available on YouTube. So psychologists and psychiatrists to be getting in contact directly with the patient is a program that is available in the country, in Turkey. So new technologies are also developing. And for instance, when the patient is anxious, how can this person control himself? Or in for instance, intrusive decision, intrusive thought passing through the mind of the individual, how the patient retracts from that is also significant in terms of BDT. So these are all mentioned again. Why digital health is valuable? Because this has an easy access. We can talk about 95% around worldwide, and uh, for the internet access, we can talk about 8 billion people. 95% of this is accessible by the world population. So there's also the location flexibility and time flexibility. For instance, a patient that you're seeing with BDT once weekly, but compared to that, if you can do it based on a program, you can remind the patient every day so that they can tick out some responsibilities daily. Especially for the children and the teenager group, it is seen that this is very important, can contribute a lot. So this is an objective and impartial approach as well. Continuous and instant access, as I mentioned. Why digital health? Again, another factor, because it's a low cost. But of course, there are projects that started with a low cost but cannot be proceeded with. And also, with regards to the addiction, it is well established that digital addiction occurs at very high rates among children and adolescents. From a digital health perspective, gamification elements such as rewards, levels, points, and tasks are employed to enhance the motivation of target populations like children and youth. And digital interventions can make the therapeutic process more engaging and enjoyable, thereby boosting participation and adherence to treatment. And they can, of course, yield meaningful outcomes for groups with limited access to conventional rate. So the dropout rates are quite significantly reduced from the studies for the effects of digital CBT on anxiety, depression, obsessive compulsive disorder, insomnia. It has effects suicidal ideation, substance usage disorder, parenting skills, social phobia, stress coping, well-being, post-traumatic stress disorder, eating disorder. These are all the domains in which digital health applications are ongoing and being developed. So what are the clinical applications and outcomes? So there are many studies evaluating the functionality here. YSA is the most widely used digital mental health application. This is actually a website support. It is for first came into application to control anxiety and depression in patients with orthopedic disorders. So it's a program, a 6-week program. Statistically significant improvement was found in scales when used as a support to TAU, treatment as usual. So rejoin this is actually covered by insurance. Also there is Rejoice is a prescription digital therapeutic for the treatment of major depressive disorder. And again, this is about the sleeping disorders. This is actually a FDA approved by in 2020. There are some applications that shows that it is functional in the literature, and it's a game towards for kids with attention deficit, and 25 minutes per day, 5 days per week, a total 4 weeks. This game can be played. And the reset is with regards to substance addiction. So this is FDA approved in 2017, which holds historical significance as the first digital therapeutic. This is actually a digital treatment program for 12 weeks, a structured digital treatment protocol. It's using CBT and OD system, which does the organization, the administration of the program. So there's a lot of applications and studies on Sparks. No FDA, but it is useful. This is a CBT-based role-playing game developed for the adolescents, but for the role-playing situation, part of the things, it is important. And this is another meta-analysis written in 2024 in 1,290 patients evaluated in 18 studies, and the effect size was found to be low in the adolescents' own feedback, and the effect size was found to be moderate in parental evaluation. This is a digital CBT. So a parent is positive, but adolescent is a little bit negatively approaching the program. But with digital CBT and therapist support, it has shown similar and non-inferior treatment outcomes to standard treatment, which is predominantly evidence-based. So 14 to 26 a week, RCATs and CDQ results were evaluated. Although digital support interventions were there, no significant difference. There's also significant response for the part that we're following digitally. So the limits of digital use with regards to health or addiction, when we ask the question, so for the 0 to 18 months age group, the recommended screen time, screen use not recommended at all. For instance, Notes says that except for interactive video chats, for instance, with caregiver. For instance, when the kid is away from mother, of course, mother and kid can interact together through video calls. That is okay. Between 18 and 24 months, the recommended screen time will be very limited under parental supervision. But here we have the note that the preference should be high quality content, for instance, the BBC Kids, Sesame Street, and so on. So co-viewing with the parent encouraged. So I would like to encourage this. So if we don't have any emotion in the eyes of the parent, the child will be neutral as well. So we have to have a good time spending with the kid. Between 2 and 5 years, no more than 1 hour per day. The preference should be high quality programs, co-viewing and discussing the content together. For instance, ads can have a negative effects. Between 6 and 12 years, this is individually tailored to time limits that needs to be structured. As my colleagues previously mentioned, balancing the daily sleep, physical activity, and academic obligations and face-to-face interactions, these should be in place. If these are the conditions that are fulfilled, we can open some space for children in that sense. Between 13 and 18 years, set clear limits and pursue limits. So with regards to digital interventions, we can talk about literature starting from 2019, 2020, and telepsychiatry side of the things is actually increasing after the pandemics. And digital interventions against digital addiction. So there's the conclusion in that sense that says that the evidence indicates that current interventions to reduce digital addiction are weak, and data from more and better designed studies with larger sample sizes are needed to establish robust evidence. So CBT group therapies, exercise, IIP, so combination of CBT, play art, therapy, conflict, stress management, psychosocial intervention, reality therapy, screen time should be organized, and all these perspectives are significant, but the effect size is low. So sample size should be increased and evaluated in that framework. Here we have again targeting and determining the target is important here. So there's this digital interventions for combating internet addiction in young children qualitative study. So in that study, there is between methods of 7, 11, 8 children, 22 parents, and 6 therapists involved. Google Family Link, YouTube Kids, Apple Parental Control are evaluated. So these interventions are thought to be useful in supporting healthy digital behaviors and facilitating parental supervision. So this was an easy article, so I put it on. So okay, so digital interventions against digital addictions. Again, we have digital media use disorder 32 child and adolescents. This is another study with reset application, 20 weeks randomized controlled study. It is a self-reported scale and statistically significant and compared with the wait list. So I am trying to finish everything in 15 minutes. Okay, so although there are many applications for digital addiction in the application, the awareness part is important. So go to your on your phone and check what is the timing that you spend on your mobile phone. This actually shakes us because when we are talking to our children as well over the phone, we should be aware of the timing that we spend actually also on our phones. So I also mentioned about this already about this reset. And here are some basic applications. For instance, in this forest application, the purpose is to reduce smartphone dependency and enhance focus. So whenever you're away from the phone, the tree actually grows. And there's Stay Free application that monitors and limits screen time via in-app analytics. Not only feedback and also raising awareness is also important. Even those two are important. Okay, I'm passing and I am concluding here. Thank you.